Welcome to Emergency Insights. I'm James Carter. Today we're focusing on acclimatization and high-altitude medicine, a topic that's increasingly relevant for healthcare providers working in diverse environments. When the human body ascends to higher altitudes, it encounters a hypoxic environment due to the decrease in barometric pressure and, consequently, the partial pressure of oxygen. The body initiates a series of physiological adaptations to cope with this challenge. The first and most immediate adaptation is known as the hypoxic ventilatory response. Here, the carotid body senses the reduced oxygen levels and prompts an increase in ventilation, effectively helping the lungs take in more oxygen. However, this increased ventilation leads to a state of respiratory alkalosis. In response, the kidneys begin to excrete bicarbonate in an effort to restore acid-base balance. Over time, additional acclimatization responses occur, including the release of Erythropoietin, which stimulates an increase in hematocrit, thereby enhancing the blood's oxygen-carrying capacity. For safe ascent, the general recommendation is to climb no more than 1,000 feet, or about 305 meters, in a single day. Additionally, every third day should be a rest day, with no net elevation gain. This gradual approach allows the body to adjust and reduces the risk of altitude illness. Typically, full acclimatization to a new elevation is achieved within 4 to 6 weeks.
Pharmacological interventions can also play a role. Acetazolamide, commonly known as Diamox, is frequently used to facilitate acclimatization. It works by promoting the excretion of bicarbonate in the urine, which helps correct the alkalosis brought on by the hypoxic ventilatory response. Acetazolamide not only reduces the likelihood of developing altitude sickness, but can also be used in its treatment. Understanding the terminology of altitude medicine is crucial for clinical assessment. Low altitude ranges from sea level to 5,000 feet or 0 to 1,524 meters. Medium altitude is defined as 5,000 to 8,000 feet, or 1,524 to 2,438 meters. High altitude spans from 8,000 to 12,000 feet, or 2,438 to 3,658 meters. Very high altitude covers 12,000 to 18,000 feet, or 3,658 to 5,486 meters, and extreme altitude is anything above 18,000 feet, or 5,486 meters. It's important to note that altitude illnesses are rare below 5,000 feet, though some individuals may begin to feel the effects of hypoxia even at these elevations. The incidence of altitude-related illnesses increases as elevation rises, making acclimatization and preventative strategies essential for those ascending to higher altitudes. That concludes today's episode of Emergency Insights. I'm James Carter. Thank you for joining me as we explored the physiological and clinical aspects of acclimatization and high-altitude medicine. Stay prepared, stay informed, and continue making a difference in emergency care.